Okay.
Do I have to introduce myself again?
It'd be nice, but you don't have to.
Oh, I'm gonna say my social media manager made me do this.
Yes, you can.
Hi, I'm Dr. Gary Motykie. I am a Beverly Hills board certified plastic surgeon. There's been a lot of talk about Britney Spears in the news lately, and I even had a post on my Instagram that was asking people what questions they may have about what's happening to Britney, what may she have done plastic surgery wise or may not have done. So I wanted to take a minute to just go through that really quickly. Personally, I think that Britney Spears is very attractive. I think she hasn't gone overboard on things, and I think she's had a pretty rough go of things. So I'm not trying to pick on her today. I'm just trying to answer some questions people may have about a transformation she may or may not have. So I think what I wanted to start out with was a picture of really young Britney and what I think she may have done originally. And I think it's pretty obvious that originally her nose was a little bit thicker. She had thicker skin, thicker nostrils, but overall her face when she was younger is just a little more plump, and that's natural. But as we see her a little bit older, we can see the nose changed. And as a general rule, the nose isn't just going to shrink on its own. So she most likely had a finesse rhinoplasty here to thin the nose, the tip of the nose, and bring it in a little bit. I think otherwise her face really didn't change that much. I think that's just a little bit of normal kind of maturation of the face and a little bit loss of that baby fat in the face. If we move forward in time, we can see again between these two photos that her nose changed once again. I think again the rest of the face, she may have again lost a little bit of facial volume, but that again is sort of a natural aging process. But you can see the nose is even more thinned out, the tip is more defined. So I'm seeing a difference between those two noses. And again, something like that doesn't just occur naturally. So I think she probably had a slight revision there to refine the nose even further. If we move forward in time to more present day, I'm getting a lot of questions about what happened to Britney Spears' brow, her lips, her smile, did her nose change again? And again, I think there are some changes in her face that are just a natural aging process. And I think another important point to say is that stress is a killer. So stress leads to a lot of premature aging. It really takes a toll on our bodies, our face, everything. And I think that some of the changes we're seeing may just be due to that. She's had a rough go of things lately. But overall, I don't think that would have as much of an effect on your smile. And there are several things that can affect a smile. One of them is having what's called a thread lift or pulling into the side of the face, and that can make the corners of the mouth turn up or give a little bit more of a Joker smile or look to the lips. Secondly, her lips are plumper, and that's usually just simply fillers or adding some volume to the lips. You can see that they are fuller, and again, as we get older, our lips don't naturally get fuller, they naturally get thinner. So something's definitely been done there to augment the lips. I think within the area of the upper lip and the nose again, with rhinoplasty or nose surgery, just doing that alone by making the incision here or doing work within the nose can change a smile and change the upper lip position, length, different things with the lip itself. So that change in the smile could be related to that. But I think secondarily, we can see that the cupid's bow of the lip has been pulled out in the middle a little bit. So along with that rhinoplasty, a lot of times we will sneak in a little bit of an upper lip lift or raise that upper lip. And that again can change the amount of upper teeth you're showing as well as the shape of that upper lip in the smile. So I'm a little suspicious that something might have been done with another rhinoplasty as well as her nostrils have been thinned out throughout progression here. So my suspicion is that something was done with the rhinoplasty in the nostrils and possibly an upper lip lift. I do want to comment that similar to the facial skin, the skin on our entire face, including on the nose, will thin as we get older. So some of that also changes in the nose is again normal signs of aging. So I think overall, I'm suspicious that she definitely has had multiple rhinoplasties, facial filler, lip augmentation, and possibly a little bit of a brow lift or something, a thread lift or an endoscopic brow lift, because we also noticed that over time her eyes or upper eyes have become less heavy. And that's not, again, something that happens with a normal aging process, whereas somebody's intervened to change that look. So to summarize, if we look at the difference as she's aged, we can see that there's definitely some surgical changes and definitely some changes that come with aging. I think that's an important distinction because a lot of people will say, well, is she just aging or did something happen? And remember, over time, a nose, as we age, would actually go this direction, not that direction. In other words, as we get older, our noses should continue to grow, get more bulbous, not thinner, skinnier, more defined. So that's telling me something's, somebody's intervened to change her nose at least several different times. Same thing with the nostrils. We can tell they become much thinner. That's not going to happen naturally. Same thing with the lips. They should have gotten thinner, but they've gotten fuller. So again, somebody's intervened. If we look at her brow, you can tell her brow used to be heavier. And here her eyes are more open and raised. Again, not a normal sign of aging. I think the rest of the face, as far as thinning of the face, some fine lines, I think she's letting herself age a little gracefully there, and I think that's fine. And I also think she's doing the right thing by not getting crazy with this. She hasn't gone over the cliff and gone overboard and really done crazy things. I think she's backing off, allowing herself to age naturally. And I do think the stress of her own personal life has taken a toll. And there are some things she can do to naturally do that without surgery. Or she can do subtle things like fat grafting, Botox, a little bit of filler to take some years off without making her look like she had a lot of work done. So I think overall we're seeing a combination of surgery, aging, and a lot of stress. So I think as she works through this, I think that we're gonna see hopefully that she reins it in, doesn't go over the edge, and I think in the end she's still beautiful. She maybe needs a little freshening up and a lot less stress in her life.
A lot of your followers have asked about her mouth area. So is that, like, for lack of better terminology, that Joker smile correctable, or is that something that will be with her forever?
When you're looking at Britney's smile and people ask, is something correctable as far as if a Joker smile or the mouth is overdone, is it correctable? And the answer is that over time it will settle a little bit, things will get better. The only things that would not change is, and I warn patients, if you do an upper lip lift or a mid-face lift where you're putting in permanent strings or permanently shortening here, those things are much more difficult to correct. But over time, dissolvable threads in the face, less invasive things will settle, will come down. So you don't want to judge it right away. We don't know what was done or how long ago it was done, but over time, generally speaking, those things will settle, which is why I warn patients not to do the aggressive, more permanent things and instead try less aggressive, less permanent things to see if you like it first.
I know I told you her age earlier, but if you look at that recent photo of her, how old would you guess that she is?
Oh, that's brutal. I'll go to that.
Do you think she looks her age?
I think, yeah, I do. I think Britney looks her age. I don't think she looks older or younger. I think she looks her age, and that's a positive and a negative. She could look younger, but like I said, I can't imagine the stress and that amount of stress, how it takes a toll on the face. So I think if she wasn't going through all that stress, she'd look a lot younger for her age. But I also think that she has reined it in enough that at this point, she can still look naturally beautiful and young for her age if she just reins it in and does some really smart tweaking now rather than going the other direction and doing extreme things. I think one of the other things about Britney is she's kept herself in shape, so she's not overweight and that adds volume to your face, whereas she's stayed in shape and so maybe lost a little volume in her face. And a lot of patients, very commonly, celebrities, just everyday people, will add volume back to the face gradually as they're losing it, and that's the smart way to do it. So over time, you don't notice a drastic change, just gradually adding a little filler to the cheeks or upper face. I think a little bit of just overall skincare, microneedling, just little tweaks would do a lot for her and patients in general. So I do think she's done a little bit of upkeep along with the other surgeries.
What's your favorite Britney Spears song?
Oops, I did it again. If you have any further questions about Britney's possible transformation, please leave your comments or questions below. #free Britney? No.